My name is Kevin Ochoa. We have Azan, Donnie, and Jaden with us in the project as well. This semester, we chose the topic of yellow fever to go ahead and talk about it. We're gonna go ahead and we broke it down into four different sections. We're going to be going over a quick overview of what yellow fever is, a quick transmission cycles, a little bit of the origins of yellow fever, and then we'll go into a case study at the end of the presentation as well. So an overview of yellow fever. Yellow fever is a dangerous, potentially fatal disease that has shaped public health in many parts of the world. It's classified as an acute viral hemorrhagic disease, meaning it can cause severe internal bleeding and organ damage. The disease is caused by the yellow fever virus, a member of the Flatterviridae family of viruses, which also include other significant diseases that we looked at during the semester, like dengue and West Nile virus and Zika virus as well. Um, the transmission, a little bit of the transmission of yellow fever. The virus spreads primarily through the bite of infected mosquitoes. Two main species of mosquitoes serve as vectors for the yellow fever. Aedes aegypti mosquitoes, which are commonly found in urban areas, and Haemophilus mosquitoes, which are more prevalent in jungle and forested regions. The mosquitoes pick up the virus when they feed on infected human or animal, feed on infected or human such as or animals such as monkeys, which are act as reservoirs for the virus. Once they're infected, the mosquitoes carry the virus for life, passing it on to anyone that the mosquito then bites on thereafter. A little bit of the geographic scope of yellow virus. Um, Yellow virus is considered endemic and naturally occurring in certain parts of the world. It is particularly widespread in regions of sub-Saharan Africa and Central and South America. These areas provide the perfect environment for mosquitoes that spread the virus. With warm temperatures, dense populations, and mosquito hosts, the proximity to forested or jungle areas where the mosquito circulates in wildlife. Um, Travelers to these regions are at like significant risk. For a lot of them that are unvaccinated, outbreaks can occur, and when the virus spills over from rural areas to more densely populated areas, that's when they see huge influxes and spikes. Um, some clinical characteristics. While yellow fever outbreaks may not dominate the headlines, the disease remains a major public health concern. In areas without robust vaccination programs or mosquito control measures, it can spread rapidly, causing like devastating epidemics of the virus. The virus also poses a dual threat affecting both human and animal populations, requiring coordinated response to prevent and manage outbreaks in the future. So the understanding how yellow fever spreads is also important. The region where it's most common and the role of mosquitoes in its transmission is essential in protecting communities and preventing future outbreaks. With modern tools like vaccination and mosquito control, we have the ability to significantly reduce the burden of the disease um, in the future. Um,
Yeah.
in regards to trends and geographic patterns, yellow fever continues to be a significant public health challenge, particularly in parts of the world. We'll look into a little bit of the most prevalent areas that are of risk. Like I said earlier in the beginning, the disease is particularly common in sub-Saharan Africa and parts of South America. These regions have the ideal combination of climate and mosquito populations that allow the virus to thrive. While the disease has long been a concern in these regions, certain trends are causing a worrying resurgence of the virus. Climate changes has altered the ecosystem, creating more favorable conditions for mosquitoes to breed and spread the virus. Urbanization is a significant factor. As more people move to cities, mosquitoes that previously thrived in rural areas have adapted to urban environments, increasing the risk of outbreaks in densely populated areas. And then population growth and increased global travel are amplifying the spread of the virus. Larger populations provide more opportunities for mosquitoes to transmit the virus, while international travel increases the risk of yellow fever reaching new areas. Um, the age group most impacted by yellow fever is 20 to 30-year olds. This is particularly active demographic, those who are working, traveling, or living in high-risk areas, further increasing their vulnerability to infection. Understanding the trends is essential for addressing the resurgence of yellow fever. By recognizing the risk posed by climate change, urbanization, and global travels, we can take proactive steps to making vulnerable populations and reduce the global burden of the disease.
Okay, so I can start discussing the public impact of yellow fever, which is going to be highlighting both its health burden and the recent impacts. So, talking about the health burden first, yellow fever remains a severe public health issue in areas without adequate vaccination programs. It causes tens of thousands of deaths annually, and beyond mortality, it causes severe cases to result in significant hospitalizations, overwhelming healthcare systems, and endemic regions. There's also an economic tool. Treatment and prevention costs are high, and loss, particularly from illness, adds the strain on already vulnerable communities. Now, moving on to recent impacts, despite the availability of vaccines, we still see outbreaks, particularly in regions like sub Saharan Africa and South America, as discussed before. This is often due to incomplete vaccination coverage in these areas. Additionally, climate change is becoming a major factor, like everywhere else in the world. Changes in climate and increased urbanization create more favorable habitats for the mosquitoes that transmit the yellow fever. This means that we could see more frequent and widespread outbreaks in the future. In summary, yellow fever isn't just a health challenge, it's also an economic and social one. Um, then, when we move on to transmission dynamics, yellow fever is transmitted by Aedes and Homogeus mosquitoes. I pronounce them wrong every single time, sorry, which thrive in both urban and jungle environments. Transmission involves a cycle where humans and non-human primates serve as hosts, making it particularly challenged to control the tropical areas. The incubation and spread phase is what comes next. Once infected, the virus incubates in humans for around 3 to 6 days before the symptoms actually start to appear. During this period, an infected individual can pass the virus to mosquitoes, which then can transmit it to other people, obviously creating that cycle of infection. When it comes to environmental factors, they also play a crucial role. Warm and humid climates, poor mosquito control, urbanization, and deforestation provide the ideal conditions for the mosquito breeding and increase the human exposure to the infected mosquitoes. Finally, the importance of vaccination. Mass vaccination programs help reduce the number of infected individuals, breaking the cycle of human to mosquito transmissions and significantly lowering the risk of outbreaks. In summary, controlling yellow fever requires addressing environmental factors, enhancing mosquito control, and expanding vaccination efforts to disrupt this transmission cycle. Here's kind of an concept map. Let me make that a little bit more clear. That kind of illustrates the ecological interactions. So at the center of the transmission is the actual mosquito, which is the primary vector. The mosquitoes transmit the virus between hosts, which include the humans and non-human primates, depending on the environment. The cycle takes two main forms. The first is a sylvatic cycle, where the virus is maintained in jungle environments with non-human primates serving as the primary hosts. Transmission to human can occur when people enter these areas, often linked to deforestation, which is disrupting the natural habitats and increasing human primate contact. The second is urban settings, which the virus shifts to human to mosquito to human cycles. That's where standing water provides breeding grounds for mosquitoes. This amplifies transmission in densely populated urban environments, creating the potential for outbreaks. Environmental factors like discussed, deforestation, and the presence of standing water contribute to the spread by promoting mosquito breeding and increasing human contact with infected hosts.
We'll be going over the history of yellow fever. So deforestation, urban expansion into forested areas have dramatically increased human exposure to wildlife that serve as reservoirs for infectious disease. In the context of yellow fever outbreaks, howler monkeys, the Alauda species, play a critical role as significant reservoirs for the virus. As human activities encroach upon natural habitats, interactions between humans and these infected primates intensify, facilitating the spillover of the virus into human populations. These ecological changes not only disrupt wildlife habitats, but also create conditions that amplify disease transmission by bringing human populations into closer proximity to vectors and reservoirs. The primary vector for these outbreaks is the Haemophilus mosquito, which is predominantly found in forested regions. This mosquito plays a crucial role in the sylvatic forest-based transmission cycle of the yellow fever virus, unlike Aedes aegypti, which thrives in urban areas and is commonly associated with urban transmission of diseases like dengue and Zika. Haemophilus mosquitoes are specifically adapted to forest environments. Their activity and biting behaviors in these regions make them effective transmitters of the virus between wildlife such as howler monkeys and humans entering or living near forested areas. While yellow fever outbreaks in Brazil have consistently coincided with the rainy season during this period, increased rainfall creates ideal breeding conditions for these mosquitoes, leading to a surge in their populations. The proliferation of Haemophilus mosquitoes during the season significantly elevates the risk of yellow fever transmission, as their increased numbers heighten the likelihood of human vector contact in affected regions. This seasonality underscores the interplay between ecological and climatic factors in shaping outbreak dynamics. The low vaccination coverage in high-risk areas was very low. In 2016, vaccination rates in some rural regions fell below 60%, leaving large portions of the population vulnerable to yellow fever outbreaks. Factors such as limited access to healthcare, logistical challenges in vaccine distribution, and resource constraints hindered efforts to improve coverage in these underserved areas. This gap in immunity created ideal conditions for the virus to spread rapidly among unprotected populations. Inefficiencies in disease surveillance systems contributed to delays in detecting outbreaks and in implementing timely interventions. These gaps included underreporting of cases, insufficient monitoring of vector populations, and a lack of integration between local and national health systems. Delayed responses to emerging cases allowed the virus to spread unchecked, making containment efforts more challenging than resource intensive. Miscommunication. Public fears about vaccine safety further complicated efforts to control the epidemic. Concerns about potential side effects fueled by misinformation and inadequate public health messaging contributed to vaccine hesitancy in affected communities. This lack of trust in vaccination programs undermined efforts to achieve sufficient immunization coverage, exacerbating the epidemic's impact. Effective communication strategies addressing vaccine safety and efficacy were critical but often insufficient during the outbreak. Over 2,100 confirmed cases and then 750 deaths occurred between 2016 and 2019. And over 20 million emergency vaccines were deployed in response to this outbreak. But the lessons we learned were that strengthening surveillance and systems in at-risk zones is critical. Effective communication campaigns are essential to overcome vaccine hesitancy, and integrated approaches that address both human and ecological factors are vital for prevention. First, we have expanding mosquito habitats. Rising global temperatures are enabling mosquito vectors like Aedes aegypti to move into new regions, including parts of the southern United States, Europe, and Asia. Prolonged warm seasons increase the potential for yellow fever transmission in these areas, making climate change a major concern for disease control. Next are changing rainfall patterns. Increased rainfall creates a more stagnant water source, which promotes mosquito breeding. On the other hand, drought forces wildlife, humans, and mosquitoes into closer proximity around limited water resources, increasing the chances of virus transmission. Lastly, urbanization and deforestation exacerbate the issue. Expanding urban centers near forested areas blur the line between sylvatic and urban cycles, leading to more spillover events. At the same time, logging and agriculture expansion reduce primate habitats, driving infected wildlife closer to human populations. In conclusion, addressing these threats requires a focus on climate adaptation, mosquito control, and sustainable urban planning to prevent yellow fever outbreaks in the future.
First, under protecting primate reservoirs, conservation strategies are crucial. Safeguarding the natural habitats of the non-human primates minimizes the human-wildlife interactions and reduces the spillover risks, like we said before. Additionally, monitoring the sentient species such as howler monkeys serves as an early warning system for potential yellow fever outbreaks in the future. Next, in vector control, innovative approaches are being explored. For example, genetically modified mosquitoes are being released in some regions to suppress the population of the primary vector for the yellow fever transmission. This is an exciting advancement being tried as part of programs like the World Mosquito Program, which I thought was actually really cool. So let's start with vaccination campaigns. Mass vaccination drives are essential to reduce the yellow fever outbreaks in endemic regions. The WHO aims to vaccinate about 80% at-risk populations in Africa and South America as part of the Eliminate Yellow Fever Epidemics, or the I strategy. Um, Additionally, establishing emergency stockpiles of vaccine ensures rapid deployment during outbreaks, which is critical for containing the spread of the virus. Moving to policy recommendations, an integrated One Health approach emphasizes collaboration across human, animal, and environmental health sectors. This approach includes policies that address deforestation, urban planning, and wildlife conservation to minimize spillover risks. Finally, improving surveillance and data sharing is vital. Cross-border data sharing and real-time disease monitoring enhance the outbreak detection and allow for faster and more effective responses. In summary, combining widespread vaccination efforts with proactive policy measures and international cooperation can significantly mitigate the risk of yellow fever and ensure long-term prevention. Thank you, folks.